going to start this video with the disclaimer that I am obviously not a medical professional, and that if you feel like you have these symptoms or you feel like POTS is something of concern or you feel like you may have it, reach out to your primary physician so that you can talk and express your raised concerns for these symptoms, and most likely they will give you a referral to go see a specialist. Again, this is for educational purposes. I am not a medical professional. So I got a lot of this information from Mayo Clinic, Cleveland Clinic, Dysautonomia International, Journal of International Medicine, or Internal Medicine, I'm not sure. So just, again, not a medical professional. If you do not know, my name is Anastasia, and I am 20, and I am diagnosed with postural orthostatic tachycardia syndrome, or commonly known as POTS. I also do have a cheat sheet, so if I'm looking down, that's why. So I'm going to start off with kind of like my story with POTS. Ever since I was a kid, I have had asthma. I've also had anxiety and depression, which anxiety and depression does come in a play with POTS. A lot of people who are diagnosed with POTS are often misdiagnosed with anxiety because the symptoms are very, very similar. And I'll get into that a little bit. But, so I've always suffered with these things since I was a little kid. I also have asthma, I think I said that. And I've suffered from them almost all my life. So I don't really know where the POTS symptoms kind of interloop, or when I started to have obvious symptoms of it. But I do know that I started to have very severe symptoms, or kind of like the worst peak in my life of POTS symptoms when I got my wisdom teeth removed at 17. And I had low blood pressure before. They figured it was just anxiety, and they continued. I was under laughing gas, so I was not awake at all, and I just remember feeling terrible during the whole procedure. And after the procedure, I was prescribed codeine, and I passed out on it. And ever since then, I have had symptoms of POTS, and that's when we started to express our concerns of having POTS because it was very, very severe. I mean, this was probably like the worst point of my POTS, and I was also not diagnosed with POTS. It took me 2 years to get diagnosed with POTS. POTS, it can take anywhere from 2 to 10 years to get diagnosed. And if you are before 2 years, you are so lucky and have great doctors, and there is a lot of medical gaslighting when it comes to POTS because it is so uncommon. Actually, it is common, but it is commonly misdiagnosed, and the testing for it can be kind of extensive, and a lot of hospitals do not provide the testing. So there's just a lot of factors. Luckily, POTS has been having a lot more awareness due to COVID. One of the causes of POTS can be viral infections. So the increase of POTS has been happening recently, and it is giving a lot more research and study into it, which is great because if you did not know, POTS does not have a cure, and there is no specific treatment other than dietary changes, increase of sodium, and exercise. There is medication to alleviate symptoms, but there is no like FDA assigned medication for POTS specifically. In my case, I am on a heart failure medicine to decrease my heart rate. If I'm looking down, I'm going to start looking at my cheat sheet, just because it's kind of a lot. So the causes of POTS can be viral illness, trauma, whether it be physical or mental, pregnancy, genetics, and secondary conditions. Along with secondary conditions, that is also a type of POTS. It's called secondary POTS, common when other autonomic disorders are present. So you have Lyme's disease, I know lupus, Parkinson's, Ehlers-Danlos syndrome, and so much more are commonly also diagnosed with POTS. There is neuropathic POTS, so loss of nerve supply causing poor blood vessel muscles, leading to poor circulation. There's hyperadronic POTS. That's the POTS I have. This happens when your sympathetic nervous system is overactive. The doctor that I go to, she best described it as your body is in constant fight or flight. Your body is pumping adrenaline and you are simply sitting, eating, doing normal things, but your body is in fight or flight. Then there is hypovolemic POTS. So reduced blood flow or volume, and again, the secondary POTS. So some of the symptoms of POTS and what makes it a syndrome is there is a lot of symptoms, and everyone experiences these syndromes or symptoms differently, causing it to be a syndrome disorder kind of thing. So some people can experience lightheadedness, dizziness, fainting or near fainting. So not everyone with POTS actually passes out. Brain fog, confusion, palpitations, fatigue, shakiness, sweating, bloating, nausea, feeling sick or just general ill feeling, migraines or headaches. I also am diagnosed with migraines, which is caused by my POTS. And paleness, blood pooling. So blood pooling is basically what it sounds like. Your blood is kind of staying in a position like your fingers, your stomach. It's just not circulating properly. And then poor sleep can be caused from POTS. Waking up sweaty, just irritable, kind of those things. Okay, sorry, I got me off. So the dogs are barking. Common ways to diagnose POTS, most commonly is the tilt table test, or some doctors actually just do what they call a poor man's tilt table test. Instead of actually doing the tilt table test itself, they just make you lay down for 5 minutes, sit for 5 minutes, stand for 5 minutes. That's called the poor man's tilt table test. Or there's an actual machine, which I actually did in my case scenario, same thing, 5 minutes for each one. During a tilt table test, they will often do a QSART test, which measures the autonomic nerves that control sweating. So I'm an excessive sweater because of my POTS. That's a very common symptom. And I've also always been sweaty my entire life. So again, I have no clue when I got when I officially started getting POTS. I could have had it my whole life. I could have started to grow into it. A lot of people with POTS experience these symptoms during puberty because when you are growing and your pituitary gland is starting to excrete hormones, it messes with your vagovessel nerve, and that also controls your autonomic system, which can mess up. So some people have POTS and grow out of it. Some people don't grow out of it. In my case, I did not grow out of it. Most commonly is a tilt table test. That is how most people are diagnosed. And that is also why diagnosing is really hard, because not a lot of hospitals still do tilt table tests. Autonomic breathing tests measures the blood rate and pressure during exercise. A lot of people with POTS their symptoms cause them to be exercise intolerant. So that is another way you can diagnose it. An echocardiogram. Most of the time your EKG is normal, but you can still see that heart rate increase. And blood volume test. So if you have hypoPOTS and your blood volume is low and causes POTS, that can show POTS. A skin nerve biopsy, and a TST, a turbulent skin test. I have personally not heard of the last two, but I know the most common is the QSART test and the tilt table test. Also autonomic breathing test, so the exercise intolerance. Let's see. The ratio for POTS with female to male is a 9-to-1 ratio. So it is a more common in women, mostly again the hormones, pregnancy. It is very common in women. It affects 1% of teenagers. So I'm special, 1%. Another thing is with the symptoms, it plays a toll on your quality of life, and it's not in a way that it's, a dangerous illness. It just really messes with you physically. So it's not terminal. It just messes with you very bad. In most cases, people with POTS often have a hard time finding jobs and or have disability. So the stats for that is 48% are employed, 72% have jobs with modifications, 82% call in sick, And 21% of people with POTS actually lose their job because of their POTS. And again, there is no cure, there is no specific medications for POTS, just lifestyle changes, exercise, and medications to alleviate some of the symptoms to get you back on a healthy diet and healthy lifestyle. But like I was saying, because of COVID, this has caused a lot more people to, raise awareness for POTS, and it is more common, and long haul COVID symptoms are starting to, people are starting to get diagnosed with POTS. So there is a good thing there, but it is still a very uncommon illness to most doctors. A lot of times I'm the one educating doctors, which is why I feel like if you are having these symptoms, you should definitely research yourself. I'm not saying self-diagnose, but learning the symptoms of POTS can help you, express to your doctor what you feel like your concerns are, or hey, I want to get these testings done because this is really affecting my life. I saw 2 doctors who told me it was anxiety. So I do personally believe that, Google is a great thing, but don't abuse it. Use it for your benefit. Research so you can help educate doctors, because this is a very new illness, and a lot of doctors are what I like to call textbook doctors. So this is not being seen in the books. So educate yourself, educate others, and that is why I'm here, and I hope you liked this video.